Hello everybody, I'm Jacqueline. Today I'll be teaching you Medical Surgical Nursing 1 Respiratory System, and today's topic is respiratory failure. The word itself says that respiratory failure is it is unable to take normal breath inside and outside. That is respiratory failure. So there are respiratory failure can be due to many different reasons, but particularly when it affects lung and cardiac part, there are high chances of getting respiratory failure. So first we'll see what is respiratory failure. It is inability of the cardiac and pulmonary system to maintain an adequate exchange of oxygen and carbon dioxide in the lung. The main function of the respiratory system is to exchange the gas. As we inhale, we take oxygen. As we inhale, we take actually air. When it goes inside the lung, there will be exchange of oxygen and carbon dioxide through alveoli parts. So this is how the normal function works. When there is imbalance or inadequate, this system will have no longer capacity to do the exchange of oxygen and carbon dioxide. The lungs are being dysfunctioned. So from the normal function it turned to dysfunction. This is called as respiratory failure when there will be inadequate exchange of oxygen and carbon dioxide due to cardiac and pulmonary system inability. As you can see here, the flowchart of respiratory failure. The respiratory failure can happen or it can be caused due to two particular reasons, that is lung failure and the other one is pump failure. When the lung does not do its function such as exchanging the oxygen and carbon dioxide through alveoli, when this function has been disturbed or when there is an incapacity or inability of this particular function, there will be lung failure. When it comes to pump failure, cardiac main function is to pump the blood which carries oxygenated blood through the arteries and carbon dioxide through the ventricles or veins. When this function has been disturbed, is called as ventilator failure. This can be found out or manifested by hypercarbia. Hypercarbia is also called as hypercapnia. This means there will be increased carbon dioxide in the blood. So these are the reason why hypercarbia has been done, because there will be central depression. Central depression means there will be very slow breathing pattern. It will be slower than the shallow breathing, and there will be mechanical defect and there will be fatigue. This is how there will be pump failure happens. So these are the two reasons why respiratory failure happens. So lung failure is also called as type 1 and pump failure is also called as type 2 respiratory failure. Now we'll see what are those. Type 1 is hypoxia without hypercapnia. Type 2 is hypoxia with hypercapnia. And then we'll see what are the signs and symptoms of type 1 respiratory failure. If the person is facing respiratory failure due to a lung problem, the person will have symptoms such as cyanosis, increased respiratory rate, that is tachypnea. Cyanosis is lack of oxygen to the particular tissue, and then accessory muscle usage will be there. Tachycardia, that is increased cardiac output, will be there. Hypotension, that is called low BP. And the signs underlying that the person will have confused state. So these are the signs of type 1 failure. When it comes to type 2, the type 2 is respiratory failure due to cardiac dysfunction. Okay, so the signs are the person will be confused, drowsiness, warm peripheries, and then flapping tremor, that is jerking reaction, and then bounding pulses. Myoclonic jerking will be there. Myoclonic jerk means the person will have muscle spasm and the person's particular muscles will have jerking reaction or the movement will be there. So myoclonic jerks are spasm of the muscles. And the next sign is papilloedema. Papilloedema is swelling in optic nerve. Okay, optic disc is present in the eyes. So this optic disc will have swelling. These are the signs of type 2 respiratory failure. The other symptoms can be like there will be dyspnea, difficulty in breathing, anxiety, orthopnea. Orthopnea is when the person suddenly changes positions or there will be sudden movement of the body. He'll feel dizziness and there will be total blank or blank out, because this is also due to low blood pressure. This is called orthopnea, and there will be altered mentation and then morning headaches will be there, and seizures, drowsiness will be there, and then the person will have a nightmare, there'll be insomnia, that is, and then other sleeping disturbance will be there, impaired cough reflex. These are all the symptoms of type 2 respiratory failure. Now it's a diagnostic evaluation. How we are going to find out whether the person is having respiratory failure? First thing, through observation only we can find out the person is not taking breaths properly and is having cyanosis, etc. This is called through history collection and physical examination. We'll be finding out, and then through OBG, that is ABG, that is one of the blood tests. It is called arterial blood gas test, through which we can find out oxygen level in the blood, and we can also find out what is the carbon dioxide level in the blood, through which we can make out whether it's a type 1 respiratory failure or type 2 respiratory failure. And then blood gas analysis, this is only blood gas, like carbon dioxide and oxygen level will be found out. And then breathing level, whether the person is having a shallow breath, or the person is having central depression, or what kind of breathing pattern he's having, that one will be found out. And then there'll be cardiac checking also, or cardiac assessment will be done. So the ventricular septal defects will be found out, in cardiac stunt will be found or it will be checked, and then pathophysiological changes will be done, and then lab tests will be done. To treat this respiratory failure, it is an actually emergency condition. There will be 3 stages will be given. That is, first stage, oxygen therapy will be done, through which oxygen will be administered to the patient. It can be normal oxygen administration through cylinder, or through the mechanical ventilation can also be done. And then drug therapy, nutrition therapy, we will see what it is. Oxygen therapy, there will be treatment of it provides extra oxygen to the body to work well. Face mask can be put, or nasal cannula can be connected, or there will be fixation of mechanical ventilator, where the intubation is done, and there will be forceful administration of oxygen, and there will be forceful removal of carbon dioxide. This will be done when the person is unable to breathe at all. So the machine will be doing the breathing work. So oxygen therapy. Next one is, as I said, there will be intubation. Intubation can be done through the mouth, and there's one more procedure called as ECMO. ECMO is ECMO. ECMO means extracorporeal membrane oxygenation. When the person cannot breathe for a longer time, so there will be an incision made in the trachea, and a tube is inserted, and it will be fixed. So through this tube the person will be breathing. This is called extracorporeal membrane oxygenation. In short form we can call it as ECMO. The next treatment is drug treatment. In drug we will be giving antibiotics, that too large spectrum of antibiotics. In this one the person has a large chance of getting pneumonia, because his respiration will be affected and will be weak. That is why pneumonia is a bacteria which can be affected very soon. So antibiotics will be given in the large spectrum. Bronchodilators are given to open the bronchus. When the person has respiratory failure, his bronchus also has chances of constriction. So to remove the constriction, bronchodilators are given, so that the bronchus will be dilated enough to take in the oxygen. Next one, corticosteroids are given to shrink the swollen. Because of the respiratory failure, there will be swelling of the head, neck part, and the peripheries. To reduce that one, corticosteroids are given, so that these steroids will reduce the swelling, or you can say it is treated for the inflammation. Next one is nutritional therapy. Nutritional therapy, it is given because when the person is not able to breathe properly, and when he is on oxygenation therapy or other treatments, he is not concentrating more on eating, because already suffocating for breathing itself, so he will not concentrate on eating anything. So to nutrition therapy will be replaced by what are the metabolic demands, that one will be supplied to increase the calories, so it can prevent muscle wasting. So these are the treatments given for respiratory failure. I hope you understood this topic. If you have any doubt, you can contact me or leave in a comment section. Thank you for watching this video.